Hey guys, Brand Shipman Brown here, physical therapist, CrossFit coach, and wellness coach with Get Your Fix Physical Therapy. And what I wanted to discuss today, I've had a couple different comments made to me in the past couple days actually, or past week, about having pain in an area that they had surgery years ago. So not a recent surgery with some residual pain, but things that were there anywhere 2, 3 to 5, 10 years ago that they had surgery for and are just starting to have pain again or have never fully gotten rid of that pain that they're having around the area. So every surgery is a little bit different. They're done for different reasons. Different techniques are used depending on what is going on with the area and what needs to be done. But in general, there's a couple main reasons why this residual pain or this pain comes back in that same area. One of the huge reasons is scar tissue. Anytime you get scar tissue, anytime you have a surgery you get cut into, you're going to develop scar tissue. That's how our body heals. But what happens is if you don't get that scar tissue loosened up after surgery, it's just or broken up after surgery, it's just gonna keep developing, and it essentially likes to develop as deep as it can, so it will adhere to whatever soft tissue bone is in that area. So if it's more of a superficial, then it can go all the way down to that bone area. Sometimes when you see that puckering in there, that's when you know you have some scar tissue that's developed pretty deep. Just give an example, I had a patient years ago that was having low back pain. She had a huge abdominal surgery like 30 years prior. All I did was worked on the scar tissue in her abdomen. I did not touch her back at all, and her pain went away. Her scar tissue had just done that much to tighten up everything. And had gone that deep that we need to loosen that up. So if you're starting to get pain in an area that you had surgery previously, it's very possible that you have developed scar tissue in there that's restricting motion. The way I like to explain it is you can raise your arm up overhead, no problem. Say you had an incision in this area, and so now that scar tissue is holding down. As you raise that arm up, that area is not going to stretch as much through there. Obviously, this shirt's a little bit stretchier than, say, than your skin and fascia is. So it's not going to expand as much. So if it's holding down there, then you aren't going to. It could be restricted anywhere. So that's one reason. Another reason that we get residual pain or pain that shows up later is because of weakness. If it was never fully strengthened properly, then over time it's going to get more and more aggravated, especially if you don't maintain the strength in that area. Especially if you've had anything like a meniscus, meniscectomy, that your meniscus was taken out was shaved. If you've had any ligaments or tendons that have been shaved a little bit or reattached. You're going to have some instability and some weakness in those areas. The joint's not going to be as strong, so you need to make sure you keep those areas nice and strong and nice and stable. And to go along with that, you need to make sure those muscles stay loose. So say you do have some scar tissue around the knee, the tighter those muscles are, especially the quads and the hamstrings and the calves that cross that knee joint, the more likely that any scar tissue in there is going to be aggravated. If you already have an area that can't extend and now you're adding to a tight muscle that can't extend as well, you're just going to have more pulling in that area. So those are kind of some of the main reasons on why we still get pain in an area after a surgery. There are a ton of different reasons, and unless I can get my hands on you and kind of assess things, it's hard to say exactly, but I would say those are kind of the top 3 reasons that I see in the clinic that people are still getting pain after years after a surgery has taken place. So if you have any specific questions on your case, definitely feel free to message me directly, and I'd be happy to answer that for you or try to answer it for you. Otherwise, have a fabulous day, and I will talk to you tomorrow.